everyone. Today we will hearing about disease prevailing in rainy season, its management and prevention from our resource person, Dr. Nabam Peter. He is a health research scientist in Department of Health Service, and also he is a chief executive officer in Chief Minister Arunachal Arogya Yojana, and he was awarded state prestigious award with silver medal category. And हम सब जानते हैं कि बारिश का सीजन में everyone is come across with disease. So sir will be talking about that today. So sir, screen is yours. Please proceed with it.
I'm Dr. Nabam Peter. I'm a health research scientist in the Department of Health and Family Welfare, Government of Arunachal Pradesh, and I'm also the Chief Executive Officer, as Perry has introduced. So today's I'll be very brief and very vague in my presentation. I won't go deep because I thought my audience was secondary school secondary level school students. So I just thought I'll present in a very layman terms. So I have made my presentation on this just to arouse questioning aptitude in the minds of my audience. So I just said, okay, when is the rainy season? Why more illnesses in the rainy season? Then what are the common illnesses in the rainy season and modes of transmission? Who gets affected and what are the common presentation of illnesses and how to prevent and manage it? So with this presentation mode, so I'll start with rainy season. So everybody is we get excited about rainy season as a student. So so when is the rainy season? Or when do we call rainy season? See, and what is rainy season basically? As as we know, when summer approaches, the temperature in the land, and sea, there is a difference in pressure. So in the sea, that temperature is maintained at higher pressure, and in land it's the lower pressure. So the air this picture is very clear, and how it's from the low pressure area, the air is sucked from the sea and it moves towards the land. And when it moves towards the land, it hits the mountain, for in the foothills of Himalayas. So we receive more rains, and in the giant all these hills in northeastern India, they from the the wave air coming from the Bay of Bengal, they hit our mountains. Then we receive heavy rainfall, and the picture here shows how the monsoon day reaches to our part of the country. So there, when we say monsoon, it's up two type, two branch. One is Arabian branch, the other one is Bay of Bengal branch. So we receive the Bay of Bengal branch, the monsoon, and it hits us in the early or towards the early, month of June. So we start receiving rainy. We start calling our rainy season. I mean, from the month of June, and it'll last till the end of September. So rainy season will be between June and September for us. So like when rainy season starts, we start to have more illnesses. And why we tend to have more illnesses is because there is more chances of getting exposed to viruses and bacteria and fungal infection in the rainy season. Why? Because the high moisture contained in the air enables most of the microorganisms to thrive, and this results in transmission of number of diseases. And rainy season is also breeding months for most of the agents which transmits diseases, for such like vector-borne diseases like mosquitoes. They thrive more in the rainy season, and after the rain, the water gets stored in some tanks or some storage, like even in the bamboo crevices, it's gets the water gets stagnated. Then it becomes a breeding places for vectors, which transmits diseases. So then, what are the common illnesses in rainy season, and what are the modes of transmission? So, like now we like the most common diseases during the rainy season, they are transmitted through four mediums, like say mosquito borne, then waterborne, then airborne, and contaminated food. Through this like four mediums, we receive most of the illnesses in the rainy season. So diseases that are like more mostly transmitted or uh, are through mosquitoes or malaria. Like that we have it's Arunachal is endemic for malaria. Then dengue and chikungunya. Is not so common here, but then we know about dengue and malaria. Then water and contaminated foods. What are the diseases? We hear about typhoid. Many people, even for any fever, if they go to any clinic or any pharmacy, they'll be say, okay, आपको typhoid हो गया. That kind common. Okay, वाइडल टेस्ट किया, इसका टाइटर इतना हुआ तो आपको टाइफाइड हो गया, ऐसा कह के. So the typhoid is there. Then cholera and hepatitis A, and we have many gastrointestinal infections. Then what are the airborne diseases that are common in rainy seasons are influenza, or common flu, or COVID-19. Now we have like this COVID-19. They are present throughout the years, but it's more during the rainy season and rainy months. Then who gets affected? And this illnesses affects all the age groups, but in adults, because they have a good immune system, or if they are healthy, the diseases are mostly mild, and they present with minor infections. But in children and senior citizens, due to either for in a senior citizen, because of their poor immune system, and in children because of the lack of matured immune system, they are more prone to present these illnesses in more with more moderate or severe symptoms, and infections becomes major. Then the like what are the illnesses that I have like just mentioned. The presentations vary from illnesses to illnesses. Like if it's an like a cholera, it presents with kind of you have fever. Then diarrhea is the most the common presentation. Then if you are have listen with the malaria, you present with fever and ache and chills and rigors. And if you are presenting with typhoid, you have the fever again, that again chills and rigors. But malaria and again typhoid can be distinguished if you present to a doctor. If you tell the presentation of your fever, so we can make some distinction between malaria and typhoid. Then other diseases, they present with vomiting, diarrhea, headache, body ache, abdomen pain, etc. So like if we go deeper into each diseases, the presentations will vary. So I won't be speaking on each disease. So just I'm talking about the common presentations. Then how to prevent and manage it. So basically what we need to understand is like how to prevent, and what are the like management. Of course, management part is mostly taken care by if you are presenting to a doctor, most of the management part will be taken care of the care by the doctors. But if you're in home also, you can see most of the fever can be managed with tepid sponging, or sometime maybe you can give at home over the counter prescriptions like paracetamols you can handle, give to reduce your fever and your body ache. And if you're having headache also, with this paracetamol you can reduce. But then we advise mostly, I mean, not to try managing illnesses at home. If you are having any illnesses, it's always better to seek opinion of doctor or nurses who will identify what kind of diseases you are suffering. So I would focus on the management part, because if I start telling, so most of you might become a doctor of your own, and then you may present later when the diseases are more severe and when it's too late. So I'll be speaking more on the on the prevention aspect. So prevention, there are many for different transmissions, you have very different prevention approaches. So for mosquito-borne diseases like malaria, dengue, and chikungunya, which presents mostly with high fever, chills, body aches, and fatigue. So we do need to use mosquito nets. So in see, since Arunachal is endemic for malaria, now of course malaria is in the verge of being eliminated. So now previously we had malaria vector-borne disease control program. So those programs, they have been very successful, and in Arunachal Pradesh, the deaths due to malaria is now reduced very drastically. But we still need to be careful and keep using mosquito nets, so that you prevent mosquito being mosquito biting you and your children. So we shouldn't allow water to stagnate or collect anywhere in and around your house. So if you have a drain, or if you have or any containers which can store water for say some time, and enable this mosquito to breed. So you have to find those places where they can breed, and you shouldn't allow the water to stagnate. So your drain should be running. Drain shouldn't be stagnated with water, and any pots or flower pots that holds water for a long time, you will have to throw away those water. And like other like bamboos, if they're upright and if they're holding water, so you will have to find those things, then throw away the water. And some even that if there are tires that that are thrown away in the garden, they might be storing water for long, and it might be a place of breathing mosquito breathing. So you'll have to identify all these sources where mosquito can breathe, and avoid water stagnation. Then we have to maintain hygiene and wash bathrooms regularly. Then use mosquito repellent creams before stepping out of house. Of course, there are brands like Odomos which you can apply in your skin. But I do not know how useful they are. But mostly we should remain cover ourselves with clothing in such a way that most of the bodies are covered. So these are for waterborne, common preventive steps that can be avoided to for what mosquito-borne diseases. Then, if we were to talk about waterborne diseases, then we can, there are some we can what preventive measures that we can do is always boil water and wash fruits and vegetables thoroughly before consumption. Keep your foods covered at all times and avoid consumption of outside food. Like most of you might be interested in going to market and standing beside the hawkers, and then eating foods which may be unhygienic. Then ensure personal and environmental hygiene at all times. Now the practice is, of course, we see due to this corona, we see everyone is having hands, like an idea about hand sanitizers and washing hands. So we need to do this even for our water and foodborne diseases. Then ensure open drains and potholes in your locality. Then get your children vaccinated if they are not already. Then some of the preventive measures that can be taken for airborne diseases is like you cover your mouth and nose while coughing and sneezing. Now we have this mask everywhere. Everyone knows the concept why the mask is. You have to wear mask all the times because mask prevents prevents you spreading diseases to other, and it also prevents you getting infected from others. So it's a two-way. It's for your own protection. It's for protecting your loved one. So we just corona is also one of the airborne diseases. So we need to take measures to prevent the spread of airborne diseases. Then drink warm water every hours. You need to hydrate yourself, so you need to drink a lot of water. So carry your own boiled water, drinking water. Keep your children away from people who are already infected, and ensure they wash their hands and feet thoroughly once they're home from outdoor. Ensure homes are well ventilated. So the ventilations of your home, you should keep your windows open so that there's a air proper ventilation is there. Then other general preventive measures then is that you need to keep yourself hydrated at all times. Then follow strict personal hygienes. Then wear full sleeves and protect your skin. Eat balanced diet and keep your immune system strong. Of course, food is very important. We need to eat healthy food. So balanced diet, when we say we need to have all ingredients of a nutrition. Say it should contain protein, it should contain carbohydrate, it should contain fats, it should contain minerals. It should, so all this in the balance. We should have balanced diet. Then consume freshly washed boiled vegetables. Reduce your intake of fats, oils, and sodium, and avoid dairy products. So this is it. I'm just being very short. So this was my presentation. Thank you.
Sir, there is a question
Yeah, I
in
think.
chat box from student.
Yeah, I was just looking at the question box. So there, Miss Baibab is asking, in malaria, what type of malaria is prevailing in Arunachal Pradesh? Of course, for not only for Arunachal Pradesh, but for like any endemic places. Falciparum malaria is the one like now. We have buybacks and oval. They are not so common here in this part. So falciparum. Then causes of typhoid. Of course, as typhoid can either through food and water. So both ways.
सर मेरा एक क्वेश्चन है एक्चुअली आज का प्रेजेंटेशन का बाहर है जिससे मैं एक ब्रेस्ट फीडिंग मदर हूँ क्या मैं मतलब अभी तो बोल रही थी वैक्सीनेशन ले सकता है लेकिन डर लग रहा है तो क्या मतलब लेना कंपलसरी होगा ना मतलब खुद केयर करके रहने से होगा सर
नहीं लेने से आपके लिए ठीक है ना आई मीन सी अभी अभी जितना ये क्या है कोविड कोविड का तो ऐसे वैक्सीन इट प्रिवेंट्स मतलब द सिवियरिटी ऑफ द इलनेस का मे नॉट प्रिवेंट द टोटल इन्फेक्शन एज सच मतलब आपको इन्फेक्शन से प्रोटेक्शन देगा बोल के ना ये इतना रिसर्च डेटा तो है नहीं लेकिन इट रिड्यूसेस योर मोर्बिडिटी एंड मोर्टालिटी सो लेने से हम एज ये क्या हेल्थ डिपार्टमेंट के तरफ से हम ये कहेंगे कि ओके लेना चाहिए
न्यूज़पेपर में कहाँ से मतलब न्यूज़ मिलता है कि वैक्सीनेटेड होने का बाद भी मतलब मर रहा है ना लोगों का डेथ हो रहा है तो उसी को देख के थोड़ा मतलब कंफ्यूजन आता है कि मतलब लेने के लिए मन है लेकिन अभी फिर एक से मर रहा है बोला है फिर देख के भी कैसे लेगा ऐसे करके मतलब माइंड में आ रहा है
नहीं वो गलत प्रोपेगेंडा है कोई वैक्सीन लेके तो अभी मरा नहीं है
ओके सर
ऐसा अगर कोई वीडियो है तो मुझे भेज के देखिए मैं वो फेक है ना सही है मैं देख के बता दूंगा
ठीक है सर थैंक यू सो मच सर
मोस्टली